Did the United States make this worse?
You know, I think people are not looking at the full picture. There'll be plenty of times to step back and quarterback this, but I just want to make it very clear. The cases that got to Uganda, Uganda was prepared. That was work done in partnership with Uganda for decades. The Minister of Health is superb. They haven't had cases outside of the ones that they've contact traced, and they've only had 1 or 2 deaths, and they have, I think, 18 cases. So that's a tale of a country that Ebola came to, and the response was excellent. Where Ebola is in DRC, the U.S. government never had programs in that far north area. It was always considered incredibly unstable. When they moved into informal mining, this virus, which was probably circulating there for decades in bats, now had access and exposure between humans and bats because of people moving in for informal mines. I've been to those mining camps. They are exquisitely put together with blue tarps, but there is no ability to control any infectious disease in those camps. So when it gets into that camp, it's going to spread, and that's what happened. But why we're behind is because we didn't know about it for almost 2 months. And we have to really look into of how we failed in understanding that this was spreading.
So if we start from behind, is it possible to get ahead, Doctor? What does it take?
Well, it takes what Uganda's doing. And so I just want to be clear. I've worked on the continent for many decades. There are extraordinary Africans on the continent who know exactly what to do with Ebola. I don't know what actually happened for those first 8 to 10 weeks in DRC, and we have to figure it out. But together we built a very strong African CDC. So when people say the American response, well, the Americans have been responding to the needs. But in the end, the African CDC was put there just for this type of outbreak and controlling this type of outbreak. And so we have to ask ourselves why our institutions that we all funded didn't respond as rapidly as they needed to. Now, I know you've seen models, and I want to make it very clear. Anybody who's showing you a model doesn't have enough data right now to create it, because we don't have a good timeline for when these infections started. We don't have a good case fatality rate, which is significantly less than Zaire, which is very good news. And since the last outbreak of this type of virus, our supportive care has gotten much better, even though we don't have a vaccine or treatments. Our supportive care, IVs, oxygen has gotten much better. And now we just need to make sure that we're supplying people with what they need to be effective. And I think the U.S. government and Europe has been sending in supplies.
What are your thoughts around the World Cup, which seems to be part of this conversation, no matter who you talk to? Doctor, one of the biggest international gatherings since COVID. Is this something that Americans need to worry about? What's the greatest health concern facing the World Cup?
Well, everyone's going to the World Cup. Your biggest risks are when you're in confined areas. Many of these stadiums are wide open, have good air exchange. I don't want people to be nervous that are going to the games. It's going to be very exciting, and they should have a wonderful time. People who have immunodeficiencies should be careful in bathrooms and closed spaces, not because of Ebola, and not because we don't have any COVID actively circulating right now, or flu or RSV, but just the infectious diseases that we all carry that we expose each other to. So, yes, anytime there's human gathering and exchange, but I know the teams and their coaches have been quarantining those that came from the DRC area, and so I'm not at all worried about them. I think people should be having a great time. And if you get sick, you know, it may not have happened there. It may have happened in the airline terminal before you got on the plane. So keep washing your hands, and wash your hands before you eat and after you go to the bathrooms. And I think you'll have a great time.
I just want to mention some breaking news that just crossed the terminal. U.S. Central Command is confirming that renewed U.S. attacks on Iran have begun. Central Command forces, according to this post on X, began launching additional self-defense strikes today at 5:15 p.m. Eastern time against multiple targets in Iran at the commander-in-chief's direction. CENTCOM says the strikes are in response to Iran's unwarranted and continued aggression. But as we saw yesterday at this time with that round of strikes, CENTCOM is describing this once again as being in self-defense. We'll have to await more detail as to what exactly in terms of targets were struck here. Dr. Birx, before we let you go, as we think about the World Cup and event-oriented risks like that, even if it's not a huge risk when it comes to Ebola, is the world prepared for epidemics and pandemics of the future right now?
Well, I think that's why I keep harping back to we have to really ask ourselves what happened in those early days of northern DRC. Because since COVID, we did invest a lot in the African CDC, and we have spent 3 decades investing in laboratory capacity. And one comment I do want to make, because of what we could be helpful to the people of DRC, we have to make sure that pregnant women and young children have access to healthcare facilities in that region where there is Ebola, because they'll be afraid to go to their health center. But malaria is quite rampant there, and we could have more deaths from malaria for kids not getting treated or pregnant moms. So we just have to make sure that our response on the ground is comprehensive. Yes, we're worried about Ebola, but let's make sure that the other diseases that we know are endemic there are also being addressed.